Well, now to a claim tonight that stroke and heart attack screening is falling short, with many doctors around the world relying on flawed, outdated information. New research suggests patients classified as low risk for cardiovascular disease are being falsely reassured. Health reporter Laurie Mason explains.
Face, is it drooping on one side?
The government has a new $500,000 advertising campaign to raise awareness of the signs of stroke. And screening 90% of adults at risk of cardiovascular disease is one of its top 6 priority health targets. But new research suggests there are flaws in the way doctors internationally are currently identifying who's most at risk.
It's a missed opportunity.
The epidemiological study of 240,000 patients worldwide concludes screening hasn't helped reduce stroke numbers in the past 10 years. Lead author, AUT's Professor Valerie Fagan, says that's because GPs are still relying on an outdated algorithm or assessment checklist to identify who's most at risk, one which was written 70 years ago.
At that time, there was no evidence of the effect of behavioral or lifestyle risk factors on cardiovascular events.
He says the checklist still used today measures things such as a patient's blood pressure and cholesterol and asks questions about smoking behaviour and family stroke history. But Professor Fagan says what the checklist doesn't ask them is questions about their fruit and vegetable intake, their weight and physical activity, their alcohol consumption and emotional stress, nor does it ask them about any irregular heartbeat or atrial fibrillation, all of which are important stroke risk factors. Picking up only those deemed high risk, ruling out others, he says, incorrectly classified as low to moderate risk.
They're given false reassurance they are safe, which is not true. 80% of strokes and heart attacks are happening in these very low and moderate risk people.
Meaning those patients aren't suitably advised to make necessary improvements to their lifestyle habits, something the Stroke Foundation agrees is vital.
If that means that through research we can identify that there need to be some changes made to how that risk assessment's done, well, we certainly welcome that.
It's understood those changes are now being considered internationally to improve detection and hopefully also reduce the growing burden on precious stroke rehab resources. Laurie Mason, One News.